Good morning, anatomy students. Welcome to week of January 25th, 2021. So, if you're watching this on Monday morning, remember some point during the early day, I'd like you to make this summative assessment, if you've not already, an attempt at this pectoral girdle summative assessment. And again, I'm just trusting you don't use any diagrams or anything like that. Last week, it seemed like people progressed pretty well through the hand, and so my expectation is that at least my hope is that everybody does really well on that. So far so good. This week we're talking pelvic girdle, so hips all the way down to almost the foot. We're not going to quite get to the foot this week. I thought that would be trying to cram things in a little too much. So plate 25 is the pelvis, and so the pelvis is actually made of two bones, the coxa bones, C-O-X-A bones, the left and right. But there can be lots of regions, processes. If you see the word tubercle, that's going to be a little place that sticks out. All these places, all these processes, many of them are where muscles will attach. Um, then you'll find the study links, then the formative. So really falling into that same routine. Leg bones. So when we talk about leg bones here, really what we're talking about is the femur and the tibia and fibula. Do not call it the fibia, fibula. And so the tibia is your shin bone. That's where if you rub the front of the lower leg, it's a real kind of pointy. It's really sharp there. It's called the margin. Um, and then the fibula, which is actually a non-weight bearing bone. If you actually break that, you can still walk just fine. I mean, there may be some pain there, but that's not weight bearing. It's actually when you feel the outside of your leg down at your ankle, that little bump you feel down there, that's the end of the fibula. Then there are the review links. Then the knee. So there is a specific plate just on the knee, all those ligaments of the knee, the MCL and LCL and the the various things we have there. Four major knee ligaments. You have two on the sides and then two in the inside, the anterior and the posterior cruciate ligaments. Um, and so there's their knee ligament there that I described. And then you have formative over that knee. Then you have pelvis and leg. Next week, we're really looking at, so next week will be the foot bones and the overall bone test. So um, we'll kind of follow that same routine. Since you're taking the assessment on Monday this week, we'll go to the Monday again. And so that'll be nice. It kind of gives you the weekend also to brush up on things you might need. So the summative assessment, leg and pelvis, really won't be required until February 20, or excuse me, February 1st, I believe is the Monday. All right, so I'll be around to see some of you. Remember, if you are a remote learner and you ever want to talk to me about a specific plate, please email me and we'll set up a time and we'll make that happen. So everybody have a good week. I will see most of you at some point this week. Please set goals to make sure you successfully get these things done. All right, I will see you next time.